very good evening to all of you. Thank you so much for joining us in the latest session of the ILSS online series. I'm Nikita from India Leaders for Social Sector, and today's session is brought to you in partnership with ISPP, YIF, and ISDM.
So let me begin by welcoming all of you who have signed up for this session, and welcome Karthik. It's nice to reconnect with you after many, many years and to be able to discuss the road to recovery, given that even as we speak, no one is quite sure what the coronavirus is planning to do in India and across Indian states. Let me begin by explaining how we plan to conduct this session. Karthik and I will be in conversation for the first hour or so. And this will also include questions from the audience. And at the end of the hour, I shall open it up for more questions. This conversation is divided into two parts. In the first part, by way of background, I shall begin by asking Karthik to give us a snapshot of the impact of COVID-19 on the lives, livelihoods, and on the Indian economy, and what he thinks ought to be the main planks of a recovery plan. The second part shall focus on 5 interrelated segments dealing with effective responses, and that's the title of this seminar today. The first segment will focus on public health responses, the second on social protection, the third, very importantly, on how best to support the economy. The fourth segment will be dealing with issues of public finance, and the fifth and final segment shall discuss effective federalism and state capacity. At the end of each segment, I shall pose 2 or 3 questions from the audience, subject, of course, to how we are doing on time and how brief Karthik is in his responses. So let's start. Let's move to the first part of our presentation. Karthik, let me request you over the next 3 to 5 minutes to lay out what you consider to be the major economic and human costs of COVID to India. Over to you.
Wonderful. Are you able to see my screen? Is everyone, I've shared my screen.
Yes, I am.
Okay, perfect. So thank you so much. Let me just start by thanking ILSS, Anu, Nikita, and the organizers for putting this together, and also to Shiv, who I think we talked briefly, and I think we are connecting after 15 years. Though we'd probably spent Shiv was an inspiration when I was doing my PhD work, doing my first work on education in India, when we were following his footsteps along with others in the work done on the Probe report, which is a landmark report in education. So I think what I'm going to do today, and as you've seen, as good professors do, I assign a lot of homework even before the class. And it started out as 2 and then became 4, and then I think there was 6 op-eds in the end that I've sent you. But what I want to use this session to do is really just string together a whole bunch of closely interrelated parts that affect, I think, how the core issues that we're going to have to deal with, as we go ahead. So responding to Shiv, just in the first couple of slides, I'm just going to say, the lockdown, clearly, while we don't have good sense of the numbers of how many infections and deaths may have been prevented, I think, there's a broad consensus that the lockdown has helped in slowing the spread of the virus. But I think what is absolutely unambiguous is that these costs have been incredibly high. Okay, so I think the economic cost, the estimates suggest that the full lockdown, right, has had a negative impact on economic activity of about 65 to 75% for every week of a full national lockdown, and that this is expected to result in about 8% loss in total GDP. And to put that just in concrete numbers, another estimate suggests that each week of the lockdown is costing the Indian economy about 200,000 crores. And so, these are just enormous amounts of money. And that's about 1% of GDP, almost for every day of the lockdown. Okay, so the unemployment here, again, we have the numbers, all of these numbers. We don't necessarily have the rigor that we would like, but to the extent that CMIE has a panel that they're able to do phone surveys with, we now have estimates of about 27%. And the spike in early May represents over 100 million lost jobs across the country. And I think, what's going to make this particularly challenging, and why I have a whole section on public finance in the talk today, is that, normally when there's a problem, you kind of expect the government to step in. You look to the government to step in. But this is a situation, part of what makes this a national crisis is that kind of the increased distress in the private sector, including, workers and companies, is accompanied by distress in the government. So, the government has also suffered an enormous loss of revenue, and we don't know what these revenue numbers are going to look like. And I think there's already a sense in which most of the projections in the budget are completely out of the window. And so which means that the government is also kind of navigating this without a map. The situation at the state level is perhaps even more dire because they are at the front line of the responses, and we'll spend a fair bit of time talking about federalism as well, but they are under even more stress because they even have fewer fiscal instruments to respond to the needs of the crisis. So you've got this dual whammy where on one side you need higher expenditure, you need more spending on social protection, on economic support, on public health, but you have considerably less revenue to work with. Okay. And then I think, there's, again, all of this is based on some assumptions and modeling. But, basically, when you look at the data we have from the Indian Household Debt and Asset Survey, and Professor Tarun Ramadurai at Imperial and co-authors, have done some estimates that just show that, basically you're going to have a very large fraction of the population, right? Like he may not have enough savings to cover consumption, for more than a month. So 71% would probably, based on these estimates, not have savings to cover consumption for 3 months, which means that people are going to be close to destitute. And so the government measures have clearly mitigated this in particular. And we'll talk about, that's why, again, I'm going to have a big section on social protection. But there's no question here, right? Like, that this entire episode is disproportionately affecting the vulnerable. And, even if people are not at the verge of immediate starvation and, and they're able to borrow, but that borrowing is going to come at very high interest rates, which is then again going to increase vulnerability. So, I think some estimates suggest that I saw recently that COVID could set back over a decade of progress against poverty, because you're not just talking about a one-time loss in income, but you're talking about a destruction of assets, a destruction of other kinds of capital that will then have to be rebuilt very, very painfully. Okay. And then I think, even in terms of health, the data suggests that there have been substantial collateral damage in terms of other aspects of health, that it's affecting utilization of other health services, even if these clinics are open. So I think the data suggests that utilization of maternal health services has fallen sharply, institutional deliveries has fallen, child immunizations have fallen. And, and these are also just incredibly worrying because as it is, India, doesn't do as well as we should. And this is another margin on which you may be slipping back. So, and one of the things I'll do in this talk, which may be a little different from a lot of other such, webinars and stuff, is I'll keep going to the research as much as possible, at least on the economic side. I'm not an epidemiologist, but there's this nice recent paper that I saw presented by Jishnu Das and co-authors looking at this major 2005 earthquake in northern Pakistan. And what they find is that this was a case where the government aid and international aid actually reached remarkably well, because essentially it was a well-defined narrow area where the damage of the earthquake was. And what they found was that about when they went back about 4 years later and did these surveys, that household consumption and assets had come back. And in some cases, the quality of the houses were even better than pre-earthquake because you got new money and built new houses. But you saw like permanent long-term impacts on children's human capital. Okay, so children who who were in utero or at very young ages in those years kind of continued to stay stunted, and learning outcomes for children who were pulled out of school, even if you were pulled out for just 8 to 12 weeks, were permanently lower, particularly for households of first-generation learners. Okay, so I think the collateral damage of a lockdown extends to almost every part of the economy, including things that we may not be seeing right now. So we see the job loss, we see the income loss. We're not seeing right now the data about how devastating these costs may be in terms of long-term human capital accumulation. Okay, so so the bottom line is, regardless of the specifics of the numbers, I mean, there's just no doubt that COVID-19 has just completely wreaked havoc on both health and the economy, with the poor having been hit the hardest. And, it may well be the biggest challenge we face in independence, or at least since kind of the tough period of 65 to 71 with, the two wars, the droughts, and multiple crises hitting the country at the same time. Okay, so and I think this is just one of the most challenging times we face, not just for policy but also in not. So I think what makes the situation so difficult is that we are kind of navigating without a map, right? So we need to kind of both be flexible in how we respond, because we're going to have to innovate. It's not like there's a playbook that we can pull out and say, okay, we do step 1, 2, 3, 4. But the question is, when you're thrown into this completely unfamiliar situation, how do you navigate? And it's like what I tell my PhD students, right? So one of the hardest things emotionally for a PhD student is you've spent your lifetime being a good student, passing exams, cramming and scoring well. But when you come to that third year after your qualifiers, PhD students struggle because now for the first time, simply being smart doesn't get you there because you're navigating with a fundamentally new problem. Okay, so how do you navigate when you're in unfamiliar territory? You have to go back to first principles, right? So first principles of public health, first principles of public finance, first principles of governance. And so what I'm going to do in terms of the actions we need to take is kind of focus on what I think are the 5 or 6 most important things we need to kind of pay attention to. The first is going to be public health, and the second is going to be social protection. We're going to talk about the economy. We're going to talk about how we finance this. We're going to talk about how we design and implement an effective response in a country with the kind of population scale and diversity we have. And in particular, that's going to mean taking federalism incredibly seriously and strengthening it. So, Indian states are bigger than most countries in terms of populations. And so understanding, therefore, what functions are best done at what level of government. And then I think the deepest and longest, most vexing challenge for India today is frankly not even the ideas, because we have no shortage of intellectuals and inputs. It's in the end, it's all about execution, right? I mean, and so in area after area, we've seen the weakness of Indian state capacity. And so that's going to be then the last thing that I talk about.
Thank you, Karthik. I think your message is loud and clear that there is clearly insufficient information to make any intelligent guesses. But one thing we know for sure, that the harm and damage this is doing to the economy and to the lives of poor people, migrant workers, children, women is quite incredible. You did talk about navigating without a map. I was wondering if you're also navigating without a compass. And I think if we really want to talk about navigating with the compass, I think the next segment or next part of your presentation is really addressing the issue of how responses can be effective in these 5 or 6 broad action areas that you've outlined. So let's move to the first action area that you list, which is public health. We all know that the low levels of India's public investments in health, and this is one reason and an important reason for the extremely fragile state of public health in India. So what, according to you, would be the priorities for an effective response in public health? Over to you.
Thanks, Shiv. And again, like we were saying in the 5 minutes before, I could easily spend 6 hours, right? Spending an hour on each of these topics. And part of the reason it took me a long time last night making my slides was to cut each of these major ideas into about just 3 slides. So I apologize that this is going to be at the level of high level first principles as opposed to getting into the next level. But what I'm hoping I'll do in these things is talk about both principles and a few specifics that are then actionable. Okay. So I think by far the most important thing that's useful to do, I mean, we get inundated with media reports about case counts and, but I think it's useful to just go back to what the first principles of this disease are, right? Like, I mean, and in particular, one of the misconceptions out there that I'm particularly worried about is the sense that somehow the lockdown is going to solve the problem. And that, that once we have this lockdown, once we paid the price of the lockdown, once we've, and then we can open up. I think almost any epidemiological model, and what I put up here is one illustration from Alexis Toda, who's a colleague of mine here at UCSD, but almost any model you put up essentially has the following feature, right? Which is that what the lockdown does, what this black line over here is showing is the trajectory of what would happen if you did not intervene early, okay? So, but the lockdown moves you from the black trajectory to the red one, right? Like, I mean, so if you have a lockdown of 12 weeks, then it is slowing down your prevalence, right? Like, I mean, but then once you release the lockdown, it's going to come right back up. Okay. So what makes this virus, like, I mean, such a vexing problem is in some ways, like, it's almost the perfect parasite, right? So, Ebola, SARS, MERS, these were more dangerous in terms of lethality, but they actually killed you before you could transmit it, right? So it's almost like this is the perfect parasite that keeps its host alive long enough for it to then jump onto a bunch of others, but eventually still be lethal enough that it kills you slowly. And that's kind of why, like, global public health community has just been so petrified about this, right? So, but I think it's important to understand, therefore, what the lockdown does. The lockdown does not solve the problem, okay? But what the lockdown does is it buys you time. It buys you time to prepare for a public health strategy that will allow a substantial reopening under more manageable risk profile, okay? And I think this is the kind of situation where it's incredibly important for the media, for public commentators, to be aware that we are in a warlike situation. I mean, there are going to be casualties regardless of what decisions you make. And so it becomes really an exercise in informed risk management. Okay. So, when we open up, are casualties going to go up? Absolutely, right? There is just no denying that. The question is, like, have we done the preparatory work to keep this risk to a manageable amount, as opposed to the exponential growth, which is what people have been so scared about, okay? So what this means is, this is a very well-known figure on the internet. This is, from this incredibly cited, sourced, and well-done article on Medium. But I think, it's just worth going back to what the core principle here is, right? So, and this is what's called the hammer and down strategy, which is what the lockdown does is it buys you time to shore up the health and testing capacity, improve contact tracing abilities, and prepare for an extended period of social distancing, right? Now, I think most experts expect that the virus we're going to have to live with this for at least 12 to 18 months because that's how long it's going to take, and the most optimistic to find a vaccine. If you look at the Spanish flu, if you look at historical precedents, the second wave has often been more lethal than the first. So if anything, we have to kind of prepare for the long haul, okay? And so what are the key components, right? Like, if you look at what happens in the hammer, you're supposed to learn, okay? And I'll come back to some of my worries under each of these phases, right? So, and learning often means being incredibly transparent with your data to allow people to truly model what's going on, as opposed to kind of just trying to manage headlines or manage kind of panic. You really have to learn. And even today we have case counts, but we don't have publicly available data on the number of tests done, say, at the district level, which makes it impossible for us to even model or interpret what the absolute case count means if you don't have visibility in the denominator of district level testing and also the testing algorithms that are being used, okay? So but you first have to learn. You cut the virus growth. You understand essentially what the true cases are. You recruit personnel. You improve treatments. You get the testing and tracing in place, right? And you basically, you relax and relieve the health system pressure. And then the point is, when you get to the dance, you're going to open up. But the whole point is, can we get to a place where we can sequester 1 to 3% of the population and allow the others to function, as opposed to continue the lockdown? Because, see, I mean, the lockdown is an incredibly blunt strategy, right? So to kind of provide a more Indianized metaphor, I mean, it is like Hanuman picking up the entire mountain and coming back because he doesn't know where the magic herb is, right? So what you want to do is kind of use this time to take the doctor to the mountain to find the herbs so that you can find and isolate the specific cases of infections, as opposed to lock down the entire population. Okay, so what makes this, and again, these are all pictures from well-known public articles and public listing. The citations are all kind of in the footnotes. But again, the whole point is to understand that what makes this thing such a vexing problem is that you've got about 45% of transmission happening from pre-symptomatic individuals. So you could look and feel completely fine and still be symptomatic. And so the lockdown reflects this kind of fear that anybody around us could be a carrier, right? And then you've got another 40% of transmission that happens among symptomatic cases. So essentially what this means is that the current testing guidelines, or in the beginning, I think, were very conservative. Now, partly limited by the testing availability. So I think the guidelines made perfect sense given where we were on test availability. But the whole point is to use this time to expand the feasible set of what we can do so that you're prepared for what an optimal policy approach would look like. And in particular, I think in a world of limited testing, there are some pretty sophisticated statistics here, right? So you don't want to do simple random sampling. You want to there is both a combination of network theory and sampling theory that you want to identify who are the people who are the biggest risk of being super spreaders, which is both in terms of contacting the most number of people as well as being at risk of of transmission in terms of the nature of the interaction that you're going to have with folks. Okay, so the combination of symptomatic testing and random testing of those who are at high risk of being spreaders will then allow you to increase the likelihood that you're going to catch people early, and then accompany this by kind of intense 1 or 2 degrees or at least 2 degrees of contact tracing, and then quarantine. Right now, the quarantines may seem very excessive, but remember the whole point of the quarantine is that 1 to 3% of quarantine is what allows the rest of the economy to be opened up, and allow that dance where we kind of function for the most part with modifications, but that's going to be much better than a blanket lockdown. Okay, so then this is kind of the piece which and I think has gotten some attention, but it's what it's a complex set of issues, and I laid this out in a long op-ed in the Hindustan Times. But I think the main point here is very simple, right? Like that it's the public return on investment of this public health strategy of saying, if we need the testing, we need the tracing, we need the contact tracing and the quarantining, and this is not rocket science, right? The public health guys have been saying this over and over, so I've done nothing new over here, right? Like, I mean, the main point here is to say, because I'm a public finance economist, is to say, does this make sense? And the answer is a resounding yes, okay? So even if you go through these line items, we're saying even if you manage to get testing up to the level of Tamil Nadu, which is right now, I think, the best case in India, which is testing about 5% of the population, you could do that at about 17,000 crores. And frankly, I would double or triple this amount. So Paul Romer, who's kind of led a lot of the global kind of thinking on some of these issues, thinks that we should be at a place where we're able to test people practically, every week or every month. My university, UCSD, which is one of the leading life science research centers, our plan for potentially opening up the campus in the fall involves monthly testing of every student, faculty member, and staff. Okay, so, and that's really the only way we know about. It's not just about controlling spread. I'll come back and talk about the economy, right? Because what is the economy? The economy is essentially a set of transactions, and economies don't open when presidents and prime ministers say you're open. It opens up fundamentally when people are not kind of gripped by fear, and the way you kind of get out of that is by having a system that says I'm going to be able to catch these cases early. Okay, so but what we show here is the testing, contact tracing. So we'll talk more about ASHA workers when I get to state capacity as well. But one of the problems in India is that even our health spending is low, but even within health spending, we spend most of the money on curative health as opposed to preventive public health. Okay, so the items I'm talking about here that I think are worth public expenditure are not only high return on investment, but they're also classic public goods, right? They're public goods in that they benefit the larger public more than the individual themselves. So when I get tested, it's not really for me, it's really to reduce the risk that I'm transmitting to somebody else. When the ASHA workers are doing contact tracing, it's part of that same public good. Same with the quarantines, which is why should we have high quality paid compensated public quarantine? It's because you are holding people against their own will for no fault of their own, right? Like, I mean, in the public interest. And so these are classic public goods that would be under provided by private actors, and therefore make a strong case for public financing and provision. And just to give you some numbers, my estimates here are this will be between 75,000 and 100,000 crores a year compared to 200,000 crores a week, which is what is the cost of the lockdown. Okay, so just to wrap this up, in terms of the social returns on public health, and why I think I think there's one of the things again I get I feel is a little misleading is when the conversations are framed in terms of lives versus livelihoods. I mean, I think that's a mistake, because frankly, just like when people talk about Indian foreign policy, the best foreign policy we can have as a country for the next 20 years is, can you get consistent 8% a year growth, and that will take care of almost all your foreign policy problems. Similarly, you cannot solve your economic problems without getting the public health right, because that's the foundation. The recovery, in some ways, the biggest recovery is opening up the economy, and you cannot do that without having these public health investments in place. Okay, so And just for some perspective, so you see, one of the paradox of pandemics with regard to public opinion about whether a particular action is warranted is, if you have been effective in your preventive action, ex post, it will seem like you overreacted, right? Because if you were effective with your ex ante action, you're not going to see the spiraling, and therefore you might think, "Arey, why did we do this? Have we overreacted?" Right? So, but that's why we have to kind of look at both historical and global perspective, right? So there is a reason people are so scared about this, right? So New York City in 2 months has had 10 times more deaths from COVID-19 than the entire 9/11 attacks. The US has had more deaths in 2 months than total US deaths over 8 years in the Vietnam War. And closer to home in India, I think, again, the Spanish flu, we know it affected us. I don't think people understand the scale of these numbers, right? That in 2 years or 3 years, we've had at least 12 to 16, 12 to 16 is the range, million deaths, right? Which is 75 times more than the total number of Indian soldier deaths across World War I and World War II, okay? And so, and this is perspective, right? Because essentially when we talk about fighting a war at the border, right? Like, I mean, everybody gets emotionally riled up to the point where we say, "Acha, we're going to support the troops and we are going to kind of increase the defense budget." But the point, and Bill Gates famously said this in a TED talk in 2015, is that if you kind of follow first principles of economics and allocate spending proportional to where kind of the biggest risks are, it's almost unambiguous that we are massively underspending on the public health. Okay, so the point about the calculations on the price side, and Shiv, maybe in Q&A, we'll talk a little bit more about the granular details of how you make this happen. And that's why I have this point in state capacity at the end, right? Because I think one reasoned pushback to my arguments here is that just simply providing the money is not going to make a UP or a Bihar into a Kerala or Tamil Nadu. This reflects like decades of differential investment in public systems. So, how do we get there? And I think that's why I'm going to talk about state capacity later. But my main point here from a public finance perspective is that this is by far the highest social return on investment expenditure we need to be doing. And that's going to allow us to open up the economy safely with sequestering a fraction of the population. And then in the long term, one of the core principles which I rushed through is, how do we make sure that the short-term actions that we take are also putting us on a stronger footing for the long term for kind of correcting historical imbalances in the patterns of Indian state capacity and public expenditure. So this is what I said, that even within health, we spend much more towards curative care, which is a private good, right? I mean, so when I fall sick, I want care, but it's still a private good for me and my family. But preventive public health has a much, much higher social return on investment, okay? So, and it's important that and I'll be honest right now, okay, my biggest fear is that around the world that we are seeing a lifting from lockdown mainly because of lockdown fatigue, right? There is both a combination of lockdown fatigue and a sense that this is completely economically unsustainable. But the right way to lift the lockdown is not because you are exhausted of the lockdown, but because you have done the preparation needed to make the lockdown worth it. Now remember, I am not in any way saying that we should continue the lockdown. In fact, I think of every extra day of a lockdown as a reflection of the failed measures of what should be done during the lockdown. So the point of all of this is that the opportunity cost of each day of the lockdown is so high that it is kind of close to criminal negligence to not be using every single day of a lockdown for maximal preparatory investments on the public health side. So let me stop there and then, take a couple of questions from Shiv. And by the way, I must thank Shiv so much because I think some of my students are in this class and they'll tell you that the big risk with me is I talk really fast. And I had initially planned this to be a lecture. And Shiv was like, let's break this into modules so that, people have a chance to catch their breath. But let me stop there and take questions from Shiv.
Thanks, Karthik. I think we have to monitor time as well. So I think you have to be a little more condensed in your responses as well. I think the important message that comes out from your presentation on public health is the importance of government and public health systems. For the first time, we see that whenever a crisis like this happens, it is the frontline government health workers and the ASHAs and the Anganwadi workers and the ANMs who are there right at the community level talking to people. So I think we should really, this is the opportunity and the occasion to pay tribute to the health workers and also recognize how fragile India's healthcare system is if we don't have a strong government-run, government-owned public health system. And therefore, there's a related question which somebody has asked that says that there is a huge pressure on frontline ASHA workers who sadly are paid a paltry compensation and modest incentives. Do you think this is a serious impediment in improving community health outcomes and capacity? Do you agree that apart from the additional costs that state governments will have to incur if they pay regular wages, there is also a fear that ASHAs will also stop working hard and become less accountable to the people? So there is a cost element. Do you really think they should be made regular employees? That will push up the costs, but also will it lower accountability? So that's the question for you.
No, and it's a fantastic question, and and thanks for curating this. So in fact, and this is, and I'll talk a bit more about this in the state capacity section, right? So I think what makes kind of public sector personnel in India such a paradox, right, is that at one level we are massively understaffed, but we're understaffed in part because the pay is too high, okay, and so that means you don't have the fiscal space to hire more people, okay, and we also have this accountability problem where my own work has shown, like from all India work, that on any given day about 40% of public doctors are absent, okay, so there is a reason why, kind of in spite of kind of public systems or public clinics having better qualified providers who provide free services, that the majority of the market share is with the private sector, and that's because for all its ills, the private sector is still a little bit more accountable, okay, so this is therefore the vexing challenge, right? The vexing challenge is, like, you need more public employees, but at the same time you need to make sure that they are more accountable. So personally, I think that the structure of the ASHA workers right now, even though people might think that the compensation is low, right, I think it's really, really important to understand that actually study after study shows that, and I was going to talk about this in the end, but maybe we'll save the time and I'll talk about it now, okay, is that the locally hired workers at the village, at the community levels, who are often not more than 10th pass or 12th pass and who are paid much lower salaries, okay, than civil service employees, are at least as effective when it comes to basic primary services, right? Like, and one of our problems in terms of our public sector staffing is that because we have kind of obsessed on exam-based selection to get the best candidates, most of these candidates come from urban areas and don't want to live and be posted in the rural areas, right? So, and what I'm talking about is being validated in education, it's been validated in health, and and again, the ASHA workers, it didn't come from some penny pinching economist. The whole model came from Dr. Abhay Bang's work in Gadchiroli, and the search model, which was essentially saying that, and how do you kind of take people who are connected to their communities and give them the level of skills that allows them to be functional. So my personal view on kind of ASHAs is I would augment the stipend a little bit, but I would definitely keep the kind of contractual or 1 to 2 year contract structure of the job, because that's what you need to maintain the accountability. So, on balance, what all the evidence suggests is that India will do much better to kind of hire more people, at a lower wage than kind of hire at civil service salaries. And again, let's understand, right? So sitting in Bombay or Delhi, it looks like public workers in health and education are paid less, right? But if you go into the villages, the fact that you have 200, 300, 400 applicants for every government job already tells you that, in fact, the wage is actually too high. And that's because relative to the cost of living, relative to the opportunity cost, right? You don't need to pay that enormous premium. And that's where things get, really quite nuanced, that you want to spend more, but you want to spend it more efficiently. So I have this large paper in Indonesia, for example, showing that an unconditional doubling of teacher pay across the board, one of the most expensive things the government of Indonesia ever did, had zero impact on learning outcomes. Okay, and that paper is called Double for Nothing. So I think public sector compensation is an incredibly important area for kind of nuance, but at a big picture level, I think the ASHA workers have been one of the more effective parts of the healthcare system, partly because their compensation is partly incentivized based on performance.
Thank you, Karthik. Karthik, we have got 4 more sections to go, and we have about 25 minutes if we are sticking to the hour and giving 15-20 minutes at the end. So let's be brief. Let me move to the second segment of effective responses, which is social protection. Clearly, this is at the heart of the livelihood debate. So let's hear from you what you think are the main elements of your social protection plan.
Yeah, so I think the most important, in the interest of time, okay, so I think, again, the lockdown has been devastating to the livelihoods of the poor. We've seen this in several phone surveys of vulnerable populations. And I think, augmenting the spending on social protection is essential. And, to the government's credit, while they get a little bit of flack for this 20 lakh crore being actually a fiscal outlay, that's about 10% of that. The fiscal outlay has mainly gone on the social protection side, right? The PDS, the NREGA, and DBT to Jandhan accounts, okay? So there's no question that was needed. I think the most important point I want to make, okay, is that if you're attending this seminar today, right? I mean, if you understand English, if you're a college graduate, you're probably already in the top 1% of the population of the country, right? Like, I mean, and so that so much of the elite discourse around social protection is kind of around the sense of, okay, this is kind of, it's some form of charity. It is some form of, a minimal ethical obligation, but it is seen as kind of, there's a trade-off between this equity and redistribution and efficiency, right? So it's that, could that money be spent somewhere else? And you worry about efficiency costs in the sense that, funding the social protection system requires taxes, and there's a concern about disincentives to work, okay? But I think what is really important to understand is that one recurring fact in development economics research over the past 20 odd years with kind of careful empirical studies is that when people are really, really poor and close to subsistence, that well-designed social protection may not only improve equity, but also increase efficiency, okay? And there's multiple reasons for this, which I'll talk about. But let me first give you some really stunning results from some of my own work on NREGA. And I bring this up because frankly, it has more than anything else, this study has changed my own views on the world, right? And that's kind of why you do the research, why you do the RCTs, is to test and see if you're right. And so, I was an NREGA skeptic, honestly, about 10, 15 years ago, thinking that, if you're pushing up wages without pushing up productivity, this is kind of not going to be great for the economy, okay? But what we find using this really large-scale randomized controlled trial in Andhra Pradesh was that improving NREGA implementation quality raised wages and employment and substantially reduced poverty, right? Raising incomes by about 13%. And also what we see is, people think about the power of NREGA as being about the NREGA budget and the NREGA income. But actually, it turns out that 90% of the income gain is actually happening from non-NREGA income, okay? And so what's happening is that the presence of NREGA provides a better outside option, okay, which allows the poor essentially more it pushes up wages, and there is kind of issues of imperfect competition, monopsony, market power that employers have, which kind of explains how you get positive effects on employment as well. Okay, so the basic point is that we exist in a pre-existing world with enormous frictions and imperfections in terms of labor market power, that augmenting the outside options of the poor can improve productivity. Okay, and the other important piece is the demand channel, which I'll come back to when I talk about supporting the economy. Okay, which is what we find is that 3 years after this experiment, or after it started, we find increases in the economic census. Okay, so this is data completely independent of our research team, that we find increases in non-agricultural enterprises, non-agricultural employment. Okay, so what that suggests is that the higher income in the poor becomes an incredibly important source of demand that then builds and kind of sustains economic activity. So the most important point I want people to understand in social protection is that there is really, given the levels of poverty in India, the trade-off between equity and efficiency may be much less than we think, and in fact they may even go together. Okay, so I think so let me just get to then one very, very, very concrete proposal. Okay, essentially, the two pillars of the Indian welfare state are NREGA and PDS, right? Which is NREGA is about 0.5% of GDP, PDS is about 1%. PDS provides food security, NREGA gives you employment security. Okay. Now, so given these existing instruments, I think the government has sensibly relied on them, expanded the scope and scale of both schemes in light of the crisis. They've augmented the PDS allowance, and they've, PDS portability, I think, makes a lot of sense. They've increased the outlay for NREGA. So I strongly support both of these moves, especially because, again, going back to core public finance, both of these steps are steps where the benefits are far greater than the costs. Why? Because the cost of augmenting PDS is much lower than the fiscal cost, because the grains are sitting in your warehouses anyway. So because of your MSP and your procurement and your farmer policies, you're sitting on this grain anyway. Now people hesitate to give it away because you book the loss only when you actually distribute it. So there's sometimes perverse incentives to sit on this stockpile of grain, because as long as the asset is sitting on your books, you don't record the loss that comes from the subsidy of the PDS. Okay, but in terms of the opportunity cost of funds, it's actually a very, very effective, cost-effective thing to do. And similarly, the benefit of NREGA is much, much greater than the fiscal outlay, right? Because the majority of the gains of NREGA are actually coming due to gains in market wages. Okay. Now, but what I do believe we need as a country is the time is now ripe for a third pillar of the social safety net. And, this is essentially that the investment in the JAM platform, the Jan Dhan Aadhaar Mobile, allows us to make income transfers one of the components of our kind of social protection system. Okay. So now, the idea which I'm presenting here is a variant of, so the idea of income transfers DBT is an old one. So is the idea of a UBI, which has been in the economic survey. Multiple eminent economists have written about this. Okay, now, and there's tons of research showing all kinds of benefits of income transfers. Okay, low of universal transfers, low targeting costs, exclusion error, low administrative costs, flexible benefits, people spend the money well. But the basic problem is this, right? The basic problem is that the UBI debate has gotten lost by the fact that the amount is so large, at about 3.5 to 10% of GDP, that kind of it's made the idea a non-starter. Okay, and so my view on this is that less is more. Okay, like so specifically, I've now proposed with multiple co-authors. There's an op-ed with Paul and Sandeep that I circulated, and now there's a much longer paper I wrote with Maitri Ghatak of LSE, formulating this idea of what I call an inclusive growth dividend. Okay, and the idea is to make it much more modest, okay, pegged at about 1% of GDP, but this would be a universal unconditional monthly transfer to every Indian citizen, okay, which at current GDP numbers translates to about 120 rupees a month or 500 rupees a month for a household of 4, okay. Now, this doesn't seem much, but, if you, and again, going back to kind of the elite bubbles we live in, like if you look at the income data, the distribution data, this amount was already over 20% of monthly consumption, for the bottom 10% of the rural population. And it's about 10% for the bottom 50%. Okay, so the key design features is that it would be paid as a supplement and not as a substitute. Okay, so which is why it's important to keep the amount manageable. It would be paid at the individual level with allowances for children under 16 going into their mother's accounts, and the default is universal coverage. Okay, the default is universal coverage, but you can imagine having some kind of exclusion based on observable criteria, give it up, whatever. Okay, so I just want to spend 2 slides on kind of why I feel this is so powerful. The first is just getting the terminology, right? So when you say UBI, basic income connotes an amount that is adequate to live on, okay? And so this sets the expectation that the transfer amount will be large enough to eliminate poverty. The problem is this is just infeasible. We just don't have the money to do this, okay? And so because you set it so high, you almost kind of, the whole idea kind of is stillborn, okay? Whereas by calling it a dividend, we make it clear that this is one component of a portfolio of income streams that people would have. So, the rich own stocks and shares, and when we get a dividend, we don't expect that we're going to live on these dividends, but the dividend is a nice part of our portfolio of income, and it would be exactly that for the poor, okay? The inclusive captures the built-in progressivity of the idea, right? So because the amount is the same for all citizens, the marginal value of the transfer is obviously much, much greater for the poor. And growth captures the idea that the amount will grow equally along with growth of the overall economy. Okay, so now put together, an IGD would be a powerful symbol of universally shared prosperity that connects every citizen, regardless of income and station. So whether you are Ambani or whether you are a poor migrant, you are equal in the eyes of the state when it comes to the IGD, and this is a symbol of shared citizenship that comes equally to every single person. And I think it's a really powerful source of shared social solidarity. And one of my other bigger fears right now is, let's kind of be real about the scale of the problem we face. Okay, there's going to be a contraction in GDP. There is going to be an incredible amount of pain to go around. Okay, and what the global research of over 500 years shows that every time when there is a big reduction in income, so calamities, natural calamities, famines, you usually see an increase in social strife because people are hunkering down and fighting for the basics. And so one way of trying to at least mitigate some of that social strife that is going to be inevitable in this time of hardship, because everybody, when things get hard, you're looking for somebody to blame, right? You'll blame the politicians, you blame the business bureaucrats, you'll blame the money lender, you'll blame people of other communities. So when the pie is shrinking, there is almost always increased social conflict. So it kind of, the importance of putting in place the investments that at least create elements of shared citizenship, maybe even higher because of that symbolic value, okay? And to make sure that this is politically compatible, right? The best economic ideas will not happen if it's not politically compatible. But this is a textbook example of Sabka Saath, Sabka Vikas, right? So to the extent that this is what the Prime Minister wants to do, this is a way to actually make that happen. So I'm going to do this quickly, but it is, I recommend you guys go read the paper, but we've done an enormous amount of thinking, right? In addressing different aspects of the IGD and why this design, I think, is the right way to proceed for income transfers in India. It's affordable enough to be feasible, it's progressive, it's inclusive, and you get sustained poverty reduction. So we have these calculations, like I said, that the bottom 10% is 20% of income. Now, there's another very important subtle point about an IGD. Okay, so if you look at, for example, the Congress, the Nyay proposal. Now, one of the problems with proposals that say, let's do large transfers to the very poor, is what it does is it actually changes the rank of people on the ground. Okay, so what a lot of sociological, psychological studies show is that people get very upset if they feel that government interventions are changing the relative ranking on the ground, in a village, in a community, where you say, hey, if I am working hard enough to be at the 25th percentile of the income distribution, and the government is coming in with this big transfer for the bottom 20%, the guy at the 20th percentile is now jumping above me. Okay, and so that creates enormous resentment, right? Like, I mean, on the ground, which makes these kind of policies a little more untenable. But what you have with an IGD is there is a rank preservation. Okay, so this is the same for everybody. So, you know, to the extent that one of the reasons people work hard is not just for income, but also for status and also for relative position, this then becomes something that doesn't affect the incentives to work. Okay, so my very strong conjecture is a design like this would be socially more acceptable. I think I get very excited about the female empowerment aspect of this. So if the money is at the individual level going into the woman's account, and the amounts for the children are going into their mother's account, that itself would be a game changer in terms of female empowerment and voice within the household, and improved intra-household targeting. Okay, so almost all the poverty work we do right now is at the household level, but we're starting to see very careful research that's measuring intra-household consumption and documenting how much inequality there is within the household. Okay, so there's a paper by Rosella Calvi, who's a professor at Rice University, showing how, you know, you have a lot of non-poor people in poor households and a lot of poor people in non-poor households, because intra-household inequality is so big, and particularly, like, you know, with women and the elderly and female children bearing the brunt of that intra-household inequality. Okay, so and again, so I just think these things are enormously understudied, and this is a way of doing that. The last thing I want to talk about is work incentives. Okay, so people worry a lot about different kind of social protection programs as hurting work incentives. The key here is that the amount of the IGD is too small to actually hurt work incentives. But almost all the evidence suggests that this will increase economic activity. Okay, so now we have evidence from a high quality randomized controlled trial in Kenya of helicopter dropping money into communities, where we estimate that this is not my co-author Paul and his co-authors, that the fiscal multiplier of that is about 2.5. Okay, and I'll come back to why, therefore, I think this is the foundation of building our economic strategy. But then let's also understand, when I teach my PhD class in development economics, right, one of the most important points I make is to say, how does development happen at the aggregate level? It happens from aggregating individual decisions to undertake investments that have a positive rate of return. Okay, so a farmer adopting a new crop that is going to give you a higher return, right? So paddy is a safe crop because you flood the fields and you have an MSP. Okay, now the returns to horticulture may be higher, but what all the research shows is that in the beginning, when you switch to something new, it is risky and your income actually goes down because there is the learning curve. Okay, so a lot of people, in fact, do not kind of undertake activities and investments that will improve incomes because they don't have the cushion to insulate them from a bad outcome. Okay, so again, when you're very, very poor, you can actually get a positive effect on economic activity, right? Then, you know, financial inclusion, you know, we've spent like enormous amounts of money creating tons of Jan Dhan accounts, which is a great step, but at least 20% of these accounts are still inactive. Okay, so, you know, this makes sure that people have an instrument of formal savings because the money is going into the accounts. You start building savings. You augment the credit channel. So again, the micro studies of how banks and creditors assess credit worthiness is that the models talk a lot about collateral, but in practice, what the banks care about is cash flow. Okay, like, are you able to service the credit? So an IGD becomes an instrument that allows the poor to leverage themselves with credit, right? Like, I mean, for productive investments. And then I think, you know, coming back to state capacity, I get super excited about the IGD. You know, in fact, the expenditure secretary, Mr. Dr. Somanathan, is a, you know, incredibly smart and top class officer, he recently said in response to why the government is not doing cash transfers, he, I think, correctly said that this is easier on paper than in practice. Okay, so even just identifying households, having a database, doing this is hard. Okay, so this is not maybe something that we can switch on overnight, but doing this will be an incredible augmentation of state capacity, where we have put in place a bunch of foundations, but it will be a demonstration that the Indian state can reliably reach every citizen with some benefit month after month after month. And that itself, I think, is a huge return. So I'm going to stop on other things, but let me stop there, right? Because I kind of hopefully have made the case for why we should think about social protection, not just as charity, but something that is actually going to be the foundation of our economic recovery, right? And I'll talk a little bit more about that when I get to supporting the economy. Sorry, Shiv. I think Nikita said, we will probably go to 90 minutes. Okay.
No. We'll go to 2 hours. 2 hours. Okay. Thanks, Karthik. That's really, really fascinating to hear you on social protection. There are 2 questions that have come in from the audience. So let me get to that. The first one is, how can the government reach so many informal sector migrant workers and the populations you talk about, when most of them are undocumented, and there is a real crisis of even ensuring ration cards get to the right people even today. Mm-hmm. And the second question is, do you think that the PDS, NREGA, and the IGD now that you're proposing will result in reverse migration of laborers? In the sense that many migrant workers who have been scared and who live in such inhuman conditions in cities and slums, etc., will, after the scare of the COVID virus, may want to go back to their villages and settle down there, because it's much, the economic security they get from these benefits and whatever little work they do is much more. How will that affect the quality of life of the city dweller?
Yeah, so fantastic questions, and thanks to the audience. And again, apologies, that we're able to take only 1 or 2 of these. Maybe Anu, at some point, we can do an extend, just a more. So use this. So it's almost using this lecture as kind of the pre-read, and then kind of having the discussion, like in a flipped classroom. Then we come back with more questions. But so Shiv, both wonderful questions. See, on the first one, let me just say that, and there's a reason why I talk about the IGD as also augmenting state capacity, right? So today, part of our problem is precisely that, there is no way of knowing how to identify and target migrant workers. How do you get different kind of benefits? Now, over time, I see this as it would make sense, given the investments in Aadhaar, given the investments in the Jan Dhan platforms, that it will make sense to have a master unified database of citizens that is mapping individuals to households and has a simple indicator for whether people are eligible. See, because Aadhaar identification doesn't prove eligibility, right? So that just proves uniqueness, right? But you can imagine that there is a master database that has then an indicator for which benefits people have been, deemed eligible for. And then once you have that, over time, because we don't even have, say, a worker registration system, right? That allows us to then kind of have an integrated view of what are the benefits somebody is receiving, and how. And we'll talk about this when I come and talk about employment protection later. But I think the Jan Dhan Aadhaar moves us in that direction, but it has not been taken to its logical conclusion because it is still being used piecemeal, for individual programs. Now, of course, there are privacy concerns. Of course, there are big brother concerns. And I think it's really important, therefore, for us to proceed cautiously. But I think it's a mistake to say that the government should not actually leverage its investments in this infrastructure to full potential with regard to being able to just, be sure that they've reached everybody, right? So the beauty of an IGD is once you've set it up, you're reaching everybody, okay? And then you can imagine that you have additional databases that allow, say, a migrant worker registration system, right? That allows you to track and potentially target additional support for subgroups as and when needed based on what the underlying economic condition is. So, and it takes me back to kind of why we should think about this crisis, not just in terms of today's crisis, right? Because today's obvious crisis is the migrant worker crisis, right? But tomorrow's crisis could be something completely different, right? So it's how do we make the investments in broad-based state capacity that augment our ability as a state to respond to whatever crises the future may throw at us. Okay, so that's my broad answer to the first question. The second one, in fact, I'm going to say something, actually different to conventional wisdom, right? So there is a lot. there is a widespread view, right? Like, I mean, that migration is bad, right? Like that, in fact, the architects of NREGA, one of the things that they talked about was we want to reduce migration. Similarly, there's the sense now of like, people live in such squalid conditions. And I think that gets the causality completely upside down, okay? Like, I mean that, people live in squalid conditions in the cities because the conditions in the villages are so much worse, okay? And now, it is a reflection of how much worse the outside option is in terms of lack of any income generating activity that people still come to the cities, okay? And I think, one of the prices we may be paying, like, I mean, for, some of our legacy of believing small is beautiful is somehow the sense that the village is like, I mean, where growth and development is going to happen. And that's just not true, okay? So, if you look at a map of the US and if you look at the spatial distribution of economic activity, like 50%, over 50% of activity comes from 10 to 12 urban clusters. Okay, so less than 5% or 10% of the landmass accounts for over 50%. You look at China, the story of development is in fact inevitably accompanied by urbanization, because what we forget, and Ed Glazer has this wonderful book on the miracle of cities, right? Cities are magical things in terms of what they do for increasing productivity, increasing contact, increasing the scale of the market and make things possible, right? So, and in fact, Anirudh Krishna from Duke, right? Like, I mean, who's done some fantastic ethnographic work studying poverty, right? So he's done longitudinal studies of pathways out of poverty. And he was telling me how, he had started studying rural populations and studying the pathways out of poverty. And by default, over time, that became a study on urbanization, because the most important pathway out of poverty for somebody in the village was to have somebody successfully migrate. And then, of course, there are issues of how do you kind of integrate from the periphery of, of an urban slum community to then starting to have more and more kind of presence in the city, right? But I think it would be a mistake to somehow think about the moral of the story as saying we need to reduce migration. If anything, what makes COVID so difficult is that the most productive areas are the places with the highest human interaction are the places where the transmission is the highest, okay? Now, that being said, I do think given India's population density, there is a case for more spatially balanced development. I think if you say, look at Tamil Nadu versus Karnataka, Karnataka is an example where basically outside Bangalore and maybe Mysore, Mangalore, there's really nothing, right? Like, I mean, whereas Tamil Nadu is spatially much more distributed, right? So, and this reflects very early investments in interstate, intrastate transport between cities, right? So whether it's Chennai, I mean, people forget that people in Delhi think Chennai is south, right? You go to Chennai and you realize that all of Tamil Nadu is to the south of Chennai, right? Like, I mean, Chennai is the northern edge of Tamil Nadu. And then there is, there's Madurai, there is Salem, there is Trichy, there's Coimbatore, there is Erode, there is, so it is so much more spatially distributed. And I think there is something to be said for wanting to spatially distribute economic activity. But let's kind of completely disabuse ourselves of the notion that kind of not that urbanization and density is bad, because that is going to be the foundation of how we grow. So, so then just a last concluding thought. So, but the way to then think about the relation of these social protection systems with migration is actually very interesting, right? So, if you go look at our own NREGA work, so the hypothesis was that improving NREGA will reduce migration because now you have wages and some option in the village. But in fact, like, I mean, what you see in a lot of research studies is that there is a substitution effect, right? Which reduces migration because now you have better wages in the village. But there's an income effect, right? Because even migrating requires certain income to pay the search cost of migration. And so what you see is there's also an increase so you don't see a net reduction in migration. And so, the social protection architecture should be thought of as how do we empower individuals to have more agency, going back to like, an old Senian framing, and have the capabilities to expand the choice set that they have. Now, for some people, it may well be that the personal and family cost of migration is so high that giving them the option to stay in the village will increase their welfare. For others, it may be that providing the IGD and providing the portability of the PDS is exactly what allows them to migrate, right? Like, I mean, so one of the tragedies that this crisis has highlighted is how many migrant workers don't get their PDS benefits, right? So, and given the importance of PDS for the poor, it tells you how much higher the wage returns to migration are, that people are willing to migrate for a higher wage, even if they're losing their PDS benefit, right? So the fact that the government is highlighting and prioritizing PDS portability, I think is a great step. But if anything, I see that it should encourage migration, and that is probably net a good thing.
Thank you, Karthik. I think, in the interest of time, I'm going to change our format a little bit because every segment and then posing questions, it's exceeding the time. We have 3 segments left. The next one is what, according to you, are the most critical interventions needed to reboot the economy or support the economy. The 4th one is on public financing. What you think are the most effective ways of mobilizing financial resources for economic revival. You're one of the few people who have thought about this and come up with some very, very practical suggestions. And last, of course, is the most important one on enhancing the effectiveness of federalism and state capacity. And this perhaps is the weakest link, given that most of the responsibility for health, social protection, implementation of PDS and other programs is the responsibility of state governments. So what I would suggest is you should try to combine all these 3, combine them, because in the format we're running out of time. So if you take about 15 minutes, 20 minutes to do that, then we will still have about 10, 15 minutes of questions. Thank you. Over to you.
Perfect. Thank you, Shiv. So let me kind of jump straight to the economy, right? And I think, as you've already kind of seen, that so obviously social protection is the foundation of what we do, but in the end, that is more of a support system. The engine that's going to pull us forward is going to be jobs, investments, and productivity. Okay, so and like I think Manish Sabharwal, once famously said that the best social protection is a good job, right? Or maybe he said that the best skilling program is a good school education. And I'm kind of confusing what I'm attributing, what he said. But I think, this is unambiguous, that the best social protection is a job, okay? And to the extent that it's firms that create the jobs, supporting firms, particularly in the MSME sector, is absolutely critical, okay? Now, but if you look at what the government has done, I mean, so there is a view that industry is quite disappointed with kind of the fact that this 20 lakh crore package, that the most of the support to MSMEs is really in the form of credit guarantees, right? So it's about easing credit constraints, but there's very little direct support, either for wage support or other kind of support, okay? So now, at one level, I think while people have criticized the government, I mean, I tend to think that this is something the government actually deserves credit for, okay? And that's because what they've done is they have, by focusing on credit channels, the government remains sector agnostic, okay? So, the moment you start saying some sectors need relief, then you're unleashing this entire lobbying cycle of each industry trying to then lobby for some relief for themselves, okay? And I think it's very, very good first practice to say that let me provide broad-based support as opposed to narrow-based one, okay? So I think in that sense, the government has got it right, okay? They've got it right with regard to saying that by focusing on the credit channel, what they're also basically between the lines, okay, what they're saying, they're not saying this, but the way I read this is to say, listen, the economy is going to go through a lot of churn. There are going to be firms that are not going to make it, and that is fine, okay? The job of a government or a well-functioning economy is not to protect every firm or protect every job. It is, and I'll talk about this when I get to labor laws. I mean, it's really not about protecting the job, it's about protecting the worker, okay? So similarly, when you talk about firms, the part of the dynamism of an economy is circumstances will change. So if there were businesses that relied heavily on personal contact, and that business model is no longer viable in a post-COVID world, however painful it might be for that business, it is socially efficient for that business to shut down because the underlying business model no longer works, okay? So I think by focusing on the credit channel, the government is implicitly sending a message that the businesses that we want to support are the ones that have a viable business model, okay? We don't want to get into the business of essentially throwing good money after bad in putting on life support a company for 3 months or 6 months that is fundamentally going to be unviable in this new reality that we are, okay? So, and I grew up in Ahmedabad, and so a lot of my friends, in fact, some of my high school friends are on this, and and I really value that community, partly because academics, I think, don't spend enough time talking to businessmen, right? And so that school group gives me a sense of what MSME and entrepreneur folks are going through, right? So there's a general sense here that the government has really not done enough for the MSME sector, and I think at one level that's right. But let me come back and say what I think is in fact needed, okay? So I think in terms of first principles, they've gotten it right by focusing on the credit channel, both in terms of reducing the fiscal exposure and sending a message that we want to support the businesses that will continue to be viable. And if you're not economically viable, that we will support a cash flow problem. We're not going to support a fundamental P&L problem. Okay. Now, But the biggest problem is that while these measures are important, it does not address the demand side problem. Okay, so the problem today is even firms with viable business models that don't require intensive, say, physical interaction, you still cannot take you can't borrow, you don't want to take on your working capital, you don't want to meet your, take on workers, meet payroll and build inventory if there is no demand. Okay, so by backward induction, if the demand is collapsed, all your credit support is not going to have enough impact. Okay, so, but this is why I come back and think about the social protection as the foundation on which we need to build our economic recovery strategy. And I think the big inflection point here for India, what we have a chance to do, okay, is that several thoughtful commentators on the Indian economy. So Haresh Chawla, who really writes about technology, but he's a really thoughtful commentator, and Ratin Roy of NIPFP has made like similar observations, right? Which is that the structure of the Indian economy, the Indian growth story of the past 25 years, has been a very, very top-down story, right? That there's about 50 million Indians who earn more than 30,000 rupees a month, okay? And most of the innovation, most of the services and goods and services are geared towards that segment, okay? And they are the ones, that fire is what keeps the Indian economy burning. Their consumption directly trickles down to about 400 million workers. Okay, so the people who you employ in various capacities, right, are really actually not even in the bottom half of the population. And then you've got this bottom kind of half of the population that's literally living a hand-to-mouth existence. Okay, so going back to Tarun Ramadurai and Bimal Balasubramanian's work, I think what they document is that the bottom 25% of Indian households have zero financial savings, right, literally zero. Okay, so the point about a social protection-led approach to economic recovery is that this may allow us to invert our model of development from a top-down one to a little bit more bottom-up one, okay, where you say that an IGD or more effective NREGA puts cash in the hands of the poor, raises demand, and also boosts the credit and investments of the poor, and likely provides a large multiplier effect, right? Both because of the high marginal propensity to consume of the poor, as well as the current slack in demand. Okay, and in fact, people have expressed concerns about what does Atmanirbhar Bharat mean. Okay, that does this mean that we are retreating from globalization? Does this mean we're going to become more insular and repeat the mistakes of the 60s and 70s? And I think the jury is out on this one. Okay, so I get very concerned when I look at the creeping increase of tariffs in the past 3 or 4 years, right? A lot of it is kind of driven maybe by the fear of China, but it is also driven by domestic lobbying. Okay, and so there is a concern, of course, that we will erect these barriers. But I think the positive way to interpret Atmanirbhar Bharat is to say that, listen, whether you like it or not, what COVID is going to be doing is it is increasing the frictions in global trade, right? So, and both for geopolitical reasons as well as for practical health reasons, we are not going to be able to replicate the China model of exporting at that kind of scale, okay? And therefore, if you want to develop in a world that is kind of less dependent on global trade flows, then India's biggest asset becomes our population and our domestic consumption base. Okay, so, and again, I teach this in my class in the Indian economy, but there's a lot of work, historical work, that shows that how, building a broader based consumption class, a broader middle class, is in fact a strong predictor of better industrialization, right? Because essentially you need customers to cover the fixed cost of your capex. Okay, so coming back to our NREGA results, think about it, right? How stunning is the result that improving NREGA not only improved wages, which is not surprising, but it also improved non-agricultural enterprise count, non-agricultural employment count, suggesting that the demand channel from the bottom up can be an incredibly powerful catalyst, for the economy overall. Okay, now this is not to say that we don't have big crises in specific sectors, banking obviously, is kind of the lifeline, and like Arvind Subramaniam have said, we've gone from a twin balance sheet problem to a quadruple balance sheet problem. I think real estate, so there are sector specific work that is needed, but the way I would think about the sector specificity of policy responses is not in terms of fiscal relief, but sector specificity in terms of basically identifying the frictions, right? And how do we kind of unlock these frictions? And so to kind of unblock bottlenecks, you're going to have to do this at a sector specific level. But in terms of what are the fiscal infusions, I think the government has broadly got it right with the credit focus. But I think the one piece that's missing is the demand side. Now, the good news is that because the government has been fiscally conservative, I think they have the fiscal space to do the two things I'm talking about, right? I mean, about 0.5% to 1% on public health and about 1% on IGD is well below the 10% that they've announced. It's a non-trivial increase, but I think both of these things will have very large public ROI, public multipliers, and therefore would make sense. Okay, so for my business friends, like, from my high school, I don't have sector-specific relief for you, but this is definitely, like, what I believe will be the foundation of a broad-based economic recovery. Okay, so the next key topic here is, of course, going to be public finance, right? So everything I've discussed so far, whether it's the healthcare investments or whether it's the social protection investments, are going to require money. And like I said in the beginning, this makes it particularly, the financial issue is probably the biggest challenge that governments are struggling with, because when economic activity is down so much, so is tax revenue. And I think there's a long list of, long wish list of what multiple stakeholders would like the government to do. Sorry, actually, can we re-record this? Because I realize I'm not on screen share.
Don't worry, you can just start over again. And
yeah,
when we edit it, we'll edit out this bit.
Perfect. Just 1 second. Okay, so the next key component of an effective response is thinking through the public finance of how we are going to finance the investments that are needed to support the recovery on both the public health side as well as the social protection side, as well as kind of the broader economic support right now. Because, for example, while it's true that the bulk of the support to MSMEs is coming through expanded credit, remember that this is coming from government guarantees of expanded credit. So even under optimistic assumptions, maybe 10 to 20% of that credit will become NPAs, in which case the government will have to cover that cost as well. Okay, so regardless of how that pans out, we're going to need to finance this additional expenditure. And that is a huge problem, because the collapse in economic activity has also led to a sharp decline in GST revenue. So we're almost certainly not going to meet the budget projections, which were already quite ambitious. And so I think, to be honest, my read of the government's kind of somewhat limited response on the fiscal side and putting more of the support on the credit side fundamentally reflects the fact that they have no money. Okay, so there is just no money. And so there's a lot of kind of wish lists from multiple stakeholders. But without kind of engaging head on with this public finance question, we're not going to be able to make much headway on all of that. Okay, so I think the important thing again is to go back to first principles, right? So it's easy and popular to say that in a time of a crisis, you should throw out the playbook and do what it takes, okay? But regardless of what you do, if you borrow more, you're going to have to pay it back, okay? So we're going to have to go back to the first principles of a public finance and public expenditure, okay? So broadly, there are 4 options for the government to finance additional spending. The first is you could cut other expenditure, and there is no shortage of inefficient or wasteful expenditure that one could cut to create the fiscal space for some of the support that is going to be needed. You could increase revenues, which is going to be not just taxes, but other kind of user charges and fees. And notice that one of the things I'm doing here is I'm listing these 4 options in the order of whether state governments can do them. And the further down they are in the list, the more they are only in the domain of the government of India. Okay, so cutting other expenditure is something that both states and the center can do. Increasing revenue is again something the states can do, but they have more limited avenues for this after GST, because most of the items except alcohol and petroleum are now kind of, the states don't have the autonomy to set the rates anymore. The third thing you can do, of course, is increase borrowing, because you need to finance some emergency current consumption on the public health side and the social protection side. And so there's almost no doubt that some component of this is going to require additional borrowing. But again, remember that this is an option that while states are able to borrow, it's an option that's controlled by the government of India. And that's for good reason, because even though the government of India doesn't formally guarantee state debt, there is almost certainly an implicit guarantee through what's called the RBI mechanism, which I'll come back and explain in a moment, whereby the government of India effectively is guaranteeing a lot of the state issued debt as well. Okay, and then the final option is to print money to monetize the debt. And this is again something that people have talked about, that you cannot hold back on essential investments for the recovery for lack of cash, so you can just print the money. Okay, and that of course is an option available only to the government of India. Now, the problem, of course, is that each of these options are painful. Okay, so cutting other expenditure at a time when there is obviously greater distress is going to be difficult. Raising taxes is also going to be difficult at a time when economic activity is shrinking and at a time when you need to boost activity, and taxing is obviously going to be a further deterrent to economic activity. Increasing borrowing may be the best option in the short term, but every rupee borrowed is going to have to be repaid. And if we're not careful, you can easily get caught in a debt crisis where your interest payments in the future are ballooning so much that you're mortgaging the future by not being able to repay that debt. And finally, printing money is also not a free lunch, because essentially when you have more money and with the same amount of goods, you're basically almost certainly going to have extra inflation, and that inflation comes with a bunch of costs which again disproportionately hit the poor. Okay, so at the bottom line is we all need to understand as a country that there is going to be a contraction in the aggregate GDP in the country, and that contraction means there's also going to be a contraction in government revenue, and the size of the pie has shrunk, which means we're all going to have to undergo some pain. There is no painless way ahead. Okay, now that being said, we still have choices to make with regard to how to make the pain more manageable. Okay, and one of the key principles to keep in mind is that the cost of each of these four options probably almost certainly will increase non-linearly. And so what I mean is that there's going to be convex costs of doing more of any of these things, that a small amount of inflation may be fine, but if you're in double-digit inflation, then you pay much higher costs. Similarly, a small amount of expenditure rationalization may make sense, but when you start doing this more dramatically, then you may be cutting out more essential investments and other expenditure, and same with taxes. Okay, so the key first point is that the optimal response will be a judicious combination of all four of these options and not kind of just one or the other. Okay. The second really important point to keep in mind, and if you go back to what I've said earlier, that there are different instruments for which the central and the state and potentially local governments are best suited for. Okay, and so given the sheer scale of India, and I will come back and talk about federalism and state capacity in my last section, is that it's going to be incredibly important for us as a country to strengthen federalism and minimize frictions across tiers of national, state, and local government. And that's going to require understanding that some functions are best done at the national government level, including raising debt and potentially working with the RBI to provide additional liquidity, as well as other aspects with the economies of scale. Okay, and so that coordination across governments is going to be critical. The third is that the short-term actions should not jeopardize longer-term fundamentals. Okay, and again, I go back to 65 to 71, which, maybe that was the most challenging period we had in kind of independent India. We fought two wars in 65 and 71. There was a major food crisis that required kind of food aid even to support, basic sustenance of food consumption. So it was a crisis, right? But I would also argue that many of the biggest mistakes in economic policy we made in independent India happened in that period, right? I mean, including bank nationalization, and we are still paying the price for some of those mistakes. Okay, so it's incredibly important that we do not jeopardize the long-term prospects of the country in kind of hasty short-term actions. Okay, so and that's why you do have to go back to the first principles to create an architecture of what exactly the costs and benefits are of different options and choose appropriately. And then at the same time, I think everything I've said so far may make me sound like a fiscal conservative who doesn't want to spend, okay, because of all of these concerns. But the final thing I'm going to say is going to be in the opposite direction, okay, which is that the financing constraints should not impede essential investments needed to support public health and the economy. And that's because the counterfactual could be worse. Okay, so in the case of the public health investments, if you don't make that, I mean, like I showed you in my calculations, that the cost of that is going to be many, many times higher because of the dampening of economic activity. Similarly, on the social protection, if you don't make those basic investments, the multiplier effect of that could be even worse. And that was kind of the classic Keynesian insight around the Great Depression, that this is a place where spending money actually helps you make money because of what it does in terms of stimulating demand. Okay, so how does one therefore deal with these contradictory impulses? At one level, I'm talking about how costly it is to undergo any of these 4 steps to raise to create the fiscal space. At another level, I'm saying that the financing concerns should not impede essential investment. Okay, and I think the main point is the following. What the last point means is that the single most important thing we need to pay attention to is, for any proposed additional expenditure, what is the public return on investment? Okay, so if the public return on investment is positive and has an ROI of 1x, 2x, 3x, then it's going to make sense to do that, even if you have to borrow for it. Okay, but the crisis should not become an excuse for every interest group to kind of push for their wish list of ideas without going back to the first principles of what the public return on investment is. Okay, so if I have to unify this whole slide on the expenditure side, I would say you have to start with assessing the public return on investment. And if that is high, and if that is particularly high, like I've indicated in the public health calculations, a factor of 50 or 100, then you absolutely need to do it, and then figure out how you're going to finance it. Okay, so the ROI calculations happen first and the financing questions come second. But at the same time, the financing question is essential to enable the investments needed that have high social ROI. Okay, so I'm just going to kind of take one more slide on the public finance side and just walk through concrete examples of each of these 4 potential ideas. Okay, so on expenditure, and frankly, I think a bulk of the work will have to come here. Okay, because if you look, here and debt. Okay, but in terms of expenditure, there is no doubt that there is an enormous amount of spending in India that has what I would call a low quality of expenditure. And by quality of expenditure, I specifically mean 3 things, okay, which is low return on investment, poor targeting efficiency, as well as downstream distortions to the economy that are caused by the structure of the expenditure. Okay, so those would be my 3 key markers of quality of expenditure. And I'll give you some examples of spending that are particularly egregious, okay, on these dimensions. So I think expenditure reforms here are 3 simple ideas. Okay, the first is you could imagine, so public employee salaries are one of the largest components of government expenditure. And in fact, we have a lot of research showing that the business as usual increases in salaries typically give you very little impact in terms of productivity. Okay, so one simple idea is to link all public employee allowances other than basic pay to the government tax revenue itself. Okay, so we're not talking about performance-based pay and things that will be very difficult to implement in terms of measurement. Okay, but this is very simple because you have a top line of government tax revenue, and you say here's basic pay, and all of the allowances are linked to the macroeconomic conditions. And so there are 2 big advantages of that. One is it provides a little bit of an automatic stabilizer to fiscal outlays, that when times are good, government employees get paid more, but when you're in a crisis, they kind of share the pain with the rest of the country. Okay, and there's, I think, a deeper potential win here, which is, remember what I said all of our reforms should be things that also put us in a stronger position for the long run. Okay, and so the advantage of kind of linking elements of pay to aggregate performance is it creates a very powerful symbolic and emotional connection between government employee performance and national performance. And so even if there's some subliminal link between how the country is doing and how you are doing, it creates an additional connection between public employees and the public interest. Okay, so that's idea number 1. Idea number 2 on agriculture subsidy reforms. I think, a government is pushing this, but some of our biggest subsidy line items that have very poor quality of expenditure. So, power subsidies, fertilizer subsidies. And so these are, these do poorly on all 3 dimensions, okay, which is the social return on investment is actually very low because you're typically incentivizing the production of crops that, water intensive crops in areas that have no business growing them. So, you're basically, the return on investment is low. The targeting efficiency is low because most of the benefits go to the richer farmers. And the downstream distortions are also much larger because of these subsidies. Okay, so the government of India is pushing this in a big way. And I welcome those steps. And I think the final one where I would like to see a lot more movement, coming back to this point of quality of expenditure, okay, is if you look at the government of India's fiscal commitments, a large part of it is actually in areas that from an expenditure perspective are strictly speaking in the domain of the states. Okay, so you have centrally sponsored schemes in education, centrally sponsored schemes in health, now, and many other areas. Now, at one level, like, I mean, this makes sense because the government of India wants to achieve certain standardization in service delivery standards across the country, and the centrally sponsored schemes are a big way by which they try to do that. The problem is that if you go look at it in practice, this becomes an incredible amount of input-based straitjackets for the state. So, you know, a senior official in government was telling me how, if you look at, say, the National Rural Health Mission, that there are about 1,600 line items that are prescribed for expenditure by government of India. And the states every year have to submit a report about how they have complied on each one of those measures before they get the money released. Okay, so, and this is kind of this completely second order exercise, because so much of the research shows that inputs per se don't matter. Okay, so I would strongly push for an approach of funding in centrally sponsored schemes that reduces the input based straitjacket but improves the accountability for outcomes. Okay, so and this is something I'll come back to in the end when I talk about state capacity as well. Okay, but this is an approach that I think is warranted regardless of the crisis, but the crisis makes it even more essential that we consider how to improve efficiency in public expenditure on this dimension. So then let's talk about taxes. Now, taxes are particularly hard right now because, when you're shrinking economic activity, raising taxes is going to be a further deterrent. But at the same time, you know, when you borrow more or any other means of financing, that's going to have to be paid back. Okay, so you also need to put in place the foundational investments for how you're going to generate the revenue that's going to allow you to service that debt. Okay, so so a couple of simple ideas here, right? So okay, so Indian tax to GDP ratio is about 17 to 18%, which is far lower than OECD norms. Okay, so we do need to kind of build up the tax capacity over time. So, you know, some of these ideas, for example, would be to increase and encourage an increase in property taxes. Now, there's three reasons for this. Okay, the first is that Indian property taxes are incredibly low, okay, compared to global norms. The second is, you know, for good. When you increase taxes, you want to do this on relatively inelastic factors. Okay, so to the extent that the property is mainly a fixed investment already, that's not going to be a deterrent on the supply side as much. And I think there's a third and very important symbolic reason for why I think property taxes are important, right? So I think one of the biggest challenges for taxation in India is the breakdown of the fiscal compact, where the fiscal compact is between taxpayers and citizens, where you say, I am willing to be taxed in return for services the government is providing me. The problem today is in India is that the tax-paying class has completely seceded from being recipients of public services, right? So, you know, anybody who's paying tax is not sending their kids to a public school or going to a public clinic. And so there's this general sense in the tax-paying class that their tax money is essentially going down into some black hole that they don't see the benefits for. Okay, so to increase people's willingness to be taxed, you need to strengthen the connection between the taxes that are paid and the services that are received. And property taxes is one of those places where, because the tax collection is local and that local tax base is then connected to local service provision, that you may be able to increase tax revenue because there's going to be a tighter connection with the services received. Okay, so that's just one tax idea. Now there's going to be a bunch of others. I think increasing user charges for key services with flat rebates to the poor, I think makes a lot of sense. So, you know, thinking about, say, the Delhi model, where you say a certain amount of water and electricity, like Jameel, is provided free, but we're going to charge you above that, okay, is consistent with saying that let's have user charges with a flat rebate for the poor. Okay, so there's again a ways of generating revenue that protect the poor. So again, one of the things I talk about at great depth in my class on the Indian economy, which, you know, I will send you guys the link to the podcast, is I spent so much time on the tension between the state and the market in India and how that colors so much of our policy making. And this is going to be another example of that. Okay, now the third way in which you're going to be able to finance the spending is increasing debt, and debt is almost certainly, like, I mean, you're going to be probably the largest part of what you do here. Okay, now again, let's go back to first principles, which is that debt per se is not a problem. Okay, as long as the social IRR, or internal rate of return, is positive. The problem is that now why is that? Because, I mean, think about any capital, like any investment you make. Okay, if you're a company, you're borrowing to invest in in a plant or a factory, you're making some calculations that you expect that the rate of return on this investment is going to be 20%, your cost of borrowing is 8%, and you say, great, I can make this investment, okay? So that same logic applies for public investment, right? So if I borrow at say 7%, I have to pay back at 7%, but if the social rate of return is 20%, 25%, 30%, I should make that investment, okay? Now, the problem, so again, at some level, whether you borrow or not is independent of your debt to GDP ratio. It depends on what are you using the money for, okay? But the problem is that the bond markets do not trust the government to spend, to not spend badly, okay? Given our long and checkered history of kind of using public money very badly, bond markets basically apply a somewhat blunt threshold of saying, here is a debt to GDP ratio, here is a fiscal deficit threshold, and once you go above this, we're going to penalize the government with higher interest rates on all of your other borrowing, okay? And so one of the reasons the government is kind of disciplined and not able to kind of expand borrowing is because of the very real concern that that may increase the cost of borrowing for all of your future debt. And that again is a huge downstream cost in terms of hurting India's ability to finance the investments needed for our development, okay? So how do you manage this tension? So at one level, there is no doubt that you need to borrow. So going back to my public health investment calculations, if the public health, if the ROI to this is 50x, okay, of course you should borrow, okay? Now, the question is, how do I borrow without paying a penalty on the interest rates the bond markets are charging on the other borrowing I'm doing, okay? So one way to do this is that if you issue the debt in a special purpose vehicle, okay, that is committed to saying we're going to make these investments for this borrowing is only going to be used for the investments needed to support the post-COVID recovery, and that this is going to go through a publicly transparent ROI calculation that has a high threshold before which the money is used, okay? So then bond markets will almost certainly give you the benefit of doubt and understand that this borrowing makes sense, and if anything, not doing this borrowing is going to hurt the economy. So ideally, you need to be able to communicate to the bond markets that the borrowing that you're doing to support this investment are the kind of borrowing that will increase India's downstream creditworthiness, because if you don't do this, you're going to have an economic collapse because you have a public health collapse, and that's going to make your ability to service existing debt much worse, okay? So the key here is designing, committing, and communicating that the borrowing that you're doing is going to be for this high ROI investments. And you could issue specific COVID-related bonds or consoles. So again, Ratin Roy and others have talked about this. And so again, it's not a new idea, but I'm just reinforcing and connecting this to the first principles about the challenge that the government faces, that you need to borrow, but you need to convince the bond markets that the borrowing is going to be very, very disciplined, okay? Now, the other thing you can do if you need the borrowing, so is now the government does have assets, right? The government has tons of assets, including shareholdings in public sector enterprises, okay? So what you can do is, and this is an idea suggested, I think first by Andy Mukherjee at Bloomberg, and then Ajit Ranade has reinforced this, right? Is to borrow from the RBI, but against the assets in the PSUs, okay? So now again, what you're saying is that I want to borrow, but I'm pledging collateral, which is the assets in the public sector enterprises, okay? So and the difference here is you're not privatizing, because now is not the right time to privatize, and I don't think anybody has the political appetite to kind of, to fight for privatization. But what you're saying is that because you have these assets and holding them as collateral, if you're not able to repay the loans, that you will consider essentially diluting your equity against, of these assets and then paying back the debt. Okay, so again, the logic of that is mainly to ring fence this borrowing so that the bond markets don't penalize the rest of your borrowing, and increase the cost of servicing your debt. Now, one final example, which is again, and frankly, this is more of an expenditure reform. It's not really linked to debt, but you can see the connection with what I just mentioned, is that, a lot of people have talked about how we need privatizing, not just to raise the money, but to improve the quality of expenditure, right? The taxpayer subsidies that go into propping up companies like Air India are enormous, and even if you just stop those subsidies, you would save that money, okay? The problem is, I think that even if you believe in privatizing, now is not the right time, because you're not going to get the valuations for that the assets warrant. But I also think, like Arvind Subramanian famously said, in the kind of environment of stigmatized capitalism that we have in India, where, essentially it becomes impossible to do a big divestment without kind of facing accusations that you have done some favors to some crony group. It creates a politically very challenging environment for privatization. Okay, but what I think should be possible, and there should be broad political consensus on, or at least public consensus on, is the benefit of improving the management quality of the public sector enterprises. Okay, so what you could do is you could just move all the PSUs out of the line ministries into a special purpose vehicle like a Temasek Holdings type company. Temasek is the government of Singapore's holding company that holds all the equity in publicly run enterprises like Singapore Airlines and Neptune Orient Lines, and that vehicle then reports to Parliament and manages these public assets in the national interest. Okay, so there's several benefits here, including improved management quality, because now you can kind of manage much more professionally because you're not within the line ministry. And the other important thing is you may be able to substantially improve policy making. And so one of the future op-eds I'll be writing is kind of discussing the state in the market and how a lot of the muddle-headed thinking we have in policy with regard to the interaction between the government and the market comes from the fact that the government plays three very distinct roles, okay, in the economy. The government functions as a policymaker, functions as a regulator, functions as a provider. And the role of the private sector is very different in these three roles, right? So as a policymaker, the private sector is an ally because you want to use the private sector to expand the capacity in the country. As a regulator, the private sector has to be an equal to the government because everybody has to be treated in an equal way. But as a provider, the private sector is your competitor. Okay, so for the Ministry of Civil Aviation, the private sector is an ally. For the regulator of air traffic control and aviation safety, they are an equal to the public sector. But for Air India, the private sector is a competitor. Okay, and part of the problem is that a lot of our policy making is influenced by the view of government as a provider as opposed to government as a policymaker. Okay, so simply separating, and again, this is not rocket science, right? These were the same principles underlying kind of creating, say, TRAI and moving BSNL and MTNL into like a separate operating company. So the logic of the Telecom Regulation Authority of India is exactly this. Okay, so again, and what I'm saying is not kind of alien, it's well known, but it's a principle that can now be applied across a broad range of public sector enterprises to kind of pull them operationally out of the line ministries. Now, of course, there'll be protests, there'll be vested interests because these PSUs give the ministries a lot of their influence. But from a national interest perspective, I think this makes a lot of sense. And the Prime Minister, I think, is a reformer, though he's not a privatizer. And so this is the kind of reform that may temperamentally be in line with what the Prime Minister has indicated his own views, on these issues to be. Okay. And then the final issue is monetization. And over here, I think, I get very nervous when I see loose talk by kind of people who are seeing only the fiscal side and saying, we need the money, we should print the money if needed, but we need the money to support the various expenditure that is needed. Okay. Now, and I think this is just very, very short-sighted, okay, because essentially the moment you start talking about this, right, because what happens when you print money is fundamentally you have more money chasing the same amount of goods, okay, which is the textbook definition of inflation. And historically, countries after wars or major crises have tried to kind of, handle that expenditure by printing money. And that's usually been associated with hyperinflations, which has enormous downstream economic costs. Okay, so simply talking about this will raise inflationary expectations. And so that would divert domestic savings to unproductive assets like gold. So remember, Indians used to hold a lot of money in gold. We still do, okay? But gold is a fundamentally unproductive investment, right? But people still hold it because it's an inflation hedge. And so if people start believing that you're going to debase your currency, you're going to see effectively a flight of assets to these kind of safe assets. And that again hurts you long term because it deprives your domestic investments of the capital needed to finance those investments, okay? So I think, and I think, Dr. There's, and it would jeopardize India's hard-won inflation credibility in recent years. And a key part of India's kind of success in the macroeconomic scene in the past 20, 30 years has been resisting that temptation. Okay. Now, again, it is not to say that this should completely be ruled out, okay? But I think, markets don't care so much about whether you're printing money. Markets care about inflation, okay? So right now, we don't know if the crisis is deflationary or inflationary. So it could be deflationary if the collapse in demand is basically reducing, reducing prices. But it could be inflationary if the breakdown in the supply chains means that you just don't have the production. Okay, so then right now you just don't know. So the MPC band, which is the Monetary Policy Committee band on inflation from 2 to 6%, it gives us enough room for modest amounts of monetization if the inflation ends up being low. Okay, so there's an important difference between QE, which is quantitative easing, and monetization. Okay, so there's nothing that prevents the RBI from pushing liquidity into the government against government securities. But the key difference is that is not inflationary because the government is expected to repay those securities. Okay, so it's only when 3 years, 4 years down the line, if the government says, wait, I'm not able to repay back all of this, like, I mean, would you consider printing a certain amount of money to offset this debt? That's when you're monetizing. Okay, and based on what the inflation ends up looking like, you could consider modest amounts of monetization down the line, but that should not be something that people loosely talk about right now. Okay, so that's a lot, but it's just 2 slides, but just gives you a sense that, and the reason I'm doing this is that you cannot really think about the expenditure side without an integrated understanding of the financing side and how you're going to put these pieces together. Okay, so and I know we said that we would compress these last 2 sections and not do discussion after the second. So let me just get to my last topic, okay, which is effective federalism and building state capacity. So I think one of the biggest challenges here that we face as a country is the fact that the scale of the problem and the scale of the country is such that, we really have to go back to first principles and think about size. Okay, so I kind of want to call out the memory of Professor Alberto Alesina, one of the giants of the field of political economy at Harvard University, who just passed away this week. And, so it's particularly fitting that, I pay this tribute to him. He was one of my professors with whom I took my oral exams in political economy in my PhD. And, he has this very simple and important paper called What is the Optimal Size of Nations? Okay, so at one level, if you look at data around the country, smaller countries tend to be actually richer on average and do much better. Okay, so for a random citizen, it's actually better to be born in a small country than a big country. Okay, so what are the advantages of size? What are the disadvantages of size? Okay. So the key advantage of size is that it gives you economies of scale in many, many functions. It gives you economies of scale in defense. It gives you economies of scale in foreign affairs. It gives you economies of scale in, other aspects of how, how economies are run. But the biggest cost is that it makes it much more difficult to respond optimally to local needs, because the government is just way too far away, from where the actual kind of policy interventions are needed. Okay, and it also makes it difficult to accommodate the heterogeneity of preferences, because the bigger you get as a country, the more the diversity that has to be accommodated. And if you're trying to cater to all of this with one policy, the chances are you're going to get it dramatically wrong for a large part of the country because of how much variation there is. Okay, and so this is why federalism is such a powerful political concept, right? Because it's a structure that allows you to say, let me kind of get the benefits of economies of scale by putting the functions that need economies of scale with the central government, and let me kind of put the functions that need to better respond to local conditions at the state and local level. Okay, so and so the really important point here is that, though we kind of think that the central government is kind of superior, and often the way we run things is the government of India will send orders and instructions expecting and treat state governments really as subservient entities, right? But if you go back to the first principles of fiscal federalism, right, the state and the central government kind of, have an equal, if not, disproportionately state heavy role in the welfare of the citizens. Okay, so the majority of what affects the life of a citizen on a day-to-day basis is actually determined at the state level, right? So health, education, law enforcement, local service provision. So these are the things that touch the life of a citizen day after day after day, and most of those things really sit in the domain of the state government. Okay, so if you take a step back as a citizen and saying, what do I want my government to do, and how is government organized? It is, you want the national government to focus on roles that benefit from economies of scale and coordination. Okay, so these includes things like financing, because the central government enjoys the low cost of borrowing, or monetizing, any monetizing, because the central government controls the RBI. I mean, notionally independent, but it is still it's technically speaking, in the domain of the central government. There's purchasing and procurement, where you have the sheer scale of saying, if you're going to order as a country 70 million testing kits, that gives you an economies of scale and ability to negotiate down the prices that individual states simply would not have. Global coordination, ensuring access to vaccines, access to therapeutics, making sure that India is integrated in the global response with regard to both the drug discovery, the drug manufacturing, the treatment. So making sure that we are leveraging our size in the international domain to maximize kind of what we need for our citizens, as well as national coordination, right? So there are genuinely issues where the states might have divergent interests, and there's many examples. And I think there is an important role for a national government in doing this, as well as sharing best practices across states. Okay. But notice that it's really, okay, hang on, I'll come back to that at the end. Okay, so then when we come to the states need to lead on operational matters. So this includes implementing social protection, testing, hiring the staff needed for the health surveillance, the contact tracing, and the transparent communication regarding public health guidelines, the safety protocols. So most of these things really should live in the state level, because the optimal policy is going to vary, and operationally these departments come under the state government. And local government, in partnership with civil society, should be taking the lead in making the citizen experience as smooth as possible, okay, and securing community support for implementing national and state guidelines. So if you kind of, if the way these guidelines are implemented are ways that are insensitive to the citizens, then you're basically going to not get the popular support that is needed, okay. So now, let me just reiterate one really important thing. If you look at all of this, there is no reason for us to think of the central government as quote unquote superior, right? And because what it is they just have a different set of functions. And if you go back to the Constitution, it is not the central government, it is the union government. And this is a point that Vivek Debroy, who's the chairman of the Prime Minister's Economic Advisory Council, has made multiple times, right? So it's not like the point is not known within the government, but it is important to go back and reiterate that the role of the union government is to do the functions that allow the states to do their job better, as opposed to micromanage what the states are doing. Okay, so the central government has an incredibly important role, but the role needs to be kind of seen through the lens of what functions are best done at the central level. Okay, but this is going to be an important chance for India to, I think, reset our federalism itself in a way that better serves the interests of the citizens, as opposed to kind of reflecting, the natural tendency of government at every level wanting to abrogate more power to itself. Okay, which then gives me a natural sequence to the last point I want to make. Okay, which is the importance of state capacity. Now, many of the ideas I've discussed are not new, right? So, the test, trace, quarantine, this is not rocket science, right? People around the world understand that this is the only sustainable model, and it's the Vietnam model, it's the Kerala model, it's something that other smaller countries have done. So the question is not so much, there are, of course, some areas where you need clarity on what to do. But fundamentally in India, the issue has rarely been that of ideas or policy design. It's always been about implementation, okay? So the key questions then are, which of these ideas are most implementable? And I think what is even more important is, how do we build better state capacity to increase the capacity of the state to implement these sensible ideas, okay? And I think this is why this can be a big inflection point and a moment for India. And that's because political incentives, not just in India, but in most kind of democracies, are, typically less towards building the state capacity needed for better implementation, because that is an investment that generates returns over time. So, and I'll come back and talk about what state capacity investments mean, but typically these investments take time to pay off. Okay, so politically, it's much more rewarding to spend on schemes and programs that can generate immediate political returns, because you can go back to voters and say, see, I have launched this program for you. And this is true regardless of the political stripe of the government, right? So, the UPA 1, had the NREGS, the UPA 2 passed the NFSA, and other major acts, mainly to kind of say, go back to the voters and saying we're doing this. Similarly, with the NDA government, it was about the schemes, it was about Ujwala, it was about the housing schemes. So, so politically, it's the schemes and programs that are seen as rewarding because you can show something tangible, as opposed to the more intangible investments in improving state capacity itself. Okay, and because of this, governments in India have consistently underinvested in state capacity, and I have done tons of writing on this, which I'll refer you to at the end. But on every measure, okay, Indian state capacity is weak. And so, in fact, Professor Lang Pritchett, when he was at Harvard, has famously described weak state capacity in India as one of the 10 greatest problems facing humanity. And he's famously called India a flailing state, right? Like, I mean, where, a failing state is something that is completely falling apart. But a flailing, F-L-A-I-L-I-N-G, a flailing state is one where the connection between the head and the limbs is very, very weak, okay? So you can have beautifully written policies, but that are not getting implemented. So the bottom line is, it's not enough to point to Kerala and Tamil Nadu models for other states, because fundamentally they may not have the capacity to implement these models. And Kerala's success reflects decades of investment in public systems and public health, which has allowed them to respond effectively. Tamil Nadu, like, I mean, has also featured incredibly strong state investments in public health capacity, and you're seeing the returns to that in their response right now. Okay, so the question is, how do we do this? Now, the silver lining for India is that if you again look at the long arc of history, that historically governments tend to invest in state capacity only at a time of a crisis, like a war. Okay, so when you have a war, there's an existential crisis. You don't know, like, if you're going to make it, and that's when you say, oh my God, I need to invest in the capacity of the state to handle this crisis. Otherwise, there's no other way out. So similarly, this crisis may provide an opportunity for Indian states to invest in their own state capacity, since there may be no other option to make it through the crisis. So, and I think again, other commentators have mentioned this, right? That, that because the Indian state is still built on kind of a Mughal and British kind of colonial structural skeleton, right? That skeleton fundamentally cared only about kind of law and order and revenue extraction, right? So there's a reason why the two most important positions in the district are still the collector and the superintendent of police, okay? Because you are collecting revenue and you're maintaining the peace, okay? So what that means is that the Indian state has what I call state power without having state capacity. Okay, so the power to repress the citizens is incredible, as you see, like in some of these heartbreaking, footage of police lathi charging citizens, like, even just migrants who are trying to get back home. So this is a deep chance for us to reflect and reorient the state towards kind of being more beneficiary centered, and to build the capacity to serve citizens as opposed to the power to control citizens, which is kind of how the state functions for the most part, like I mean, at the front line. So let me just end up with my last slide on some core components of state capacity and what are some actionable items, right? Because again, the concept of the state capacity is not new, okay? So what I'm trying to do in how I'm laying out things is to provide both the conceptual clarity of what we need to do, but then take that conceptual understanding to very concrete steps that can be taken, okay? So what would building state capacity look like in practice? What are actionable items for what we can do? Okay, so the three key components of state capacity, which I'm going to talk about, is an outcome orientation and a beneficiary centered orientation, which we kind of, massively lack so far. The second is the personnel piece, and the third is going to be the better use of your limited budgetary resources. Okay, so the first component of state capacity is this, like I said, outcome orientation and beneficiary orientation. So, India is famous for announcing schemes and announcing policies because essentially you're kind of, that's kind of what you're paying attention to, okay? But you don't have visibility on the beneficiary experiences, okay? So much of my research with multiple co-authors in the past 20 years has focused on understanding how government policies translate down into benefits to the last mile beneficiary, okay? And whether it's stories of leakage, whether it's stories of other ways, or of absenteeism of teachers, doctors, in so many ways, like the system at the grassroots is highly suboptimal in terms of what fraction of the policy amounts dispersed are reaching the beneficiaries. Okay, so one very, very simple low-cost solution, which we have now tested and validated in Telangana, which I'll tell you about, is simply to have high frequency monitoring through outbound phone calls, okay, asking about beneficiary experiences. So many governments have grievance redressal cells where you say, okay, people can call in. The problem is that the most marginalized will rarely call because they have no confidence that any action is going to be taken. And like most of these, and the other problem from a government action perspective is that the inbound call centers are obviously going to represent a biased sample of people who feel strongly enough to call. So you may get 10 complaints and think that things are bad, but it may be just 10 cases are really bad out of a population of several million, in which case, maybe those were one-off exceptions rather than systemic issues. Okay, so one of the main points about why you need academic expertise and technical expertise in doing these things is basic issues of representative sampling. Okay, that are you calling a representative sample so that the numbers you're getting about something as simple as have you received your Jan Dhan transfers, have you received your PDS and the additional entitlements that the government has passed. Okay, so just having that visibility. So today what happens is and this is a really important point. Okay, and because today the way we get beneficiary feedback is when you have media going and doing reports of, say, the travails of migrant workers or the travails of of starvation deaths of people not getting their PDS. Now the problem is that given the scale of India, you've got 1.4 billion people, right? So as people have famously said about India, everything that's true, the opposite is also true. Okay, so when I see a media study, if I am a policymaker, I simply don't know whether this is the representative reality of the typical citizen, or whether because the media has an interest in sensationalizing things, that have they gone and cherry picked the one or two cases where things are really bad. Okay, so even if I'm a well-intentioned policymaker, my current feedback loop is based on self-selected anecdotes, which means that my initial instinct as a policymaker sometimes is denial, to say that, nay, you have just gone and found a few bad cases. On average, there's nothing bad happening. Okay, now sometimes it becomes impossible to deny. But the value of representative data that is collected in a high frequency way is that then you know that the data is real and you have no option but to respond to that. Okay, and so what we saw in Telangana, this was a study we did 2 years ago in the context of the Right to Bandhu scheme. So when I say we, almost everything I'm talking about here is done with different co-authors, different research studies, like with JPAL, with other organizations. But all we did here was, in the context of the Right to Bandhu scheme, we just made about 25,000 outbound calls in 2-week period to kind of ask farmers whether they had gotten their checks, whether they got it on time, whether they had to pay any bribe. And what we did was we created report cards at the level of a mandal or a block. And we basically told the mandal agricultural officers that this visibility, we will give you these reports, and the senior officials are able to monitor performance using this. Okay. And what we did was we randomly chose 25% of the mandals to do this pilot and announce to those guys. And what you saw is a significant improvement in kind of on-time payments of the checks, just from the simple announcement to lower level officials that this kind of measurement of your performance is taking place. Okay, so there was no performance pay, there was nothing. There was just the improved governance that came from real-time outcome measurement in a systematic way. Okay, and I think as we navigate this crisis in the coming months, putting this kind of investment in place is going to be enormously important. And the government will actually benefit from this kind of transparency, right? Because then when they have to both from their own response and in terms of the broader public communication, like if their data shows that the problems are in 10% of the cases, then you can tell the public that, listen, even 10% is too much. Okay, but we are doing our best, and here is our system for making sure that not only are we doing well, but we are learning that we are doing well. Okay, so that's why I think the outcome orientation is the first component of state capacity, of orienting your entire system towards delivering better outcomes, as opposed to simply asking whether you have delivered the certain inputs that you're supposed to do. Okay, now the second key component of state capacity is personnel, and the sinews of the state, so to speak, are your frontline employees who represent and translate state policies into actions that are experienced by citizens. Okay, and the problem for India is that we are both understaffed. So by most international norms, we don't have enough public employees. Okay. And in fact, one simple way of explaining the difference in performance between, say, Tamil Nadu, Kerala, and other states is if you look at the public employees per capita, the Tamil Nadu, Kerala are among the leading states compared to the poorer northern states. Okay. So there is no way the state can deliver if the state doesn't have the staffing. Okay. But the problem with government staffing is that because accountability is so poor, right? Like, the quality of expenditure in business as usual hiring is actually very, very low. Okay. And so, it's low for two reasons. It's low because the salaries are too high. Okay. And again, sitting in Delhi or Bombay, you might think that, government salaries are low. But if you go down, to any kind of village or even district in India, the reason the government jobs are so lucrative is because the pay at the entry level is many multiples of what the market wage is. Okay. So, so we are violating economics 101, right? It's because the wages are so high, we are not able to afford the staff that are needed to expand service delivery capacity. Okay. So, I would say that that's one of the biggest reasons for understaffing. Plus, the low value for money comes from the poor accountability. Okay, so there's tons of research that locally hired frontline workers who are less qualified and paid much lower wages. Okay, so this is true for locally hired contract teachers. It's true for locally hired, Anganwadi workers. So they are much less qualified than your typical government employee, but they are as effective, if not more effective, for basic service delivery, for primary school education, for Anganwadi services, for primary health. So in fact, the ASHA worker model, has been one of the most effective models that we have for service delivery in India. And that's precisely, somebody asked a question earlier and I answered this. And the reason that model has been so effective is because the compensation is based partly on a base stipend, plus allowances and incentives based on actually doing certain tasks like immunization and institutional delivery. Now, of course, that creates certain downstream problems. But, the most experts think that the ASHA part is the most well-functioning part of the healthcare system. And a big reason for that is because these are not guaranteed government jobs, okay? That these are, contractual positions for 1 to 3 years where the compensation is partly based on performance, okay? And so basically, I think this is one of the most important things. If I was kind of, in charge of health or education or any of the major social service sectors, this would probably be one of the most important things I would do. And I have an entire paper talking about a new approach to public sector recruitment. But the core idea is that you hire local staff like on shorter term contracts. You then train them modularly that allows them to increase their, increase their human capital and capacity and skills. And then you kind of promote the regular staff based on measures of skill and performance over time. Okay, so, and this is an incredible opportunity for us to invest in our public health systems, invest in our other frontline public systems, but keeping in mind that the personnel strategy has to be both cost effective in terms of money and accountability effective in terms of being able to make sure that the staff are delivering the tasks for which they are hired. Okay, and then the last point, which I've already alluded to when I talk about expenditure reform, is that I think one of India's, again, fundamental problems in terms of how we approach social policy is that we focus much more on the size of the budget rather than the quality of expenditure. Okay, so education advocates want 6% of GDP, health advocates want 3%, 4% of GDP. Okay, the problem is that we are at a tax to GDP ratio that's about half what you see in OECD countries. Okay, so you just don't have the same kind of money. So, but the flip side of this is that even at a lower level of allocation, the research shows such variation in cost effectiveness and public spending. So among the 6 op-eds I assigned for this piece, one of them was the piece I wrote after the Nobel Prize to, Abhijit Banerjee and Esther Duflo and Michael Kramer this year. And one of the points I make there is that the entire value of the JPAL approach to kind of generating evidence, in my book, one of the biggest values is being to document how there are aspects of expenditure that are incredibly cost effective and aspects of expenditure that are completely ineffective. Okay, and so moving expenditure from items that are less cost effective to more cost effective is going to be such a big force multiplier in improving the quality of what the state can deliver at a given budget envelope. Okay, so the core of building state capacity are these 3 components of do we have better beneficiary orientation and outcome measurement orientation? Are we kind of staffing and monitoring, hiring, posting, paying, promoting, managing the public sector personnel for delivering better outcomes? And are we using our limited resources in a way that's driven by evidence and cost effectiveness to maximize what you can deliver? Okay, so these are the core components of state capacity. And in fact, this new organization that I've just founded, right, which again, we've just started, called the Center for Effective Governance of Indian States. This is basically driven by kind of our belief, and this is pre-COVID, right? We were founded last year, is driven by the fact that the single most important need we have in India for improving governance is going to come from improving all of these 3 components, and that it's best done focusing at the state level. So, we are now working in detail in one state in Telangana, but the hope really is to then develop templates of how you improve state capacity by working in great depth in a few states that we can then share and make available to other states going forward. Okay, so to wrap up this entire talk, and apologies for going so far over, right? But I think my sense of why I have done this is that so much of the public discourse on COVID response has been kind of siloed. You have people writing about the health, you have people writing about the social protection, you have people writing about the budgets and the expenditure, but there is really no way to attack this in a siloed way, right? You need this integrated strategy that goes across, starts with the foundation of public health, recognizes the centrality of social protection, not just to protect the vulnerable, but as your engine of economic recovery for the reasons that I mentioned. Then you've got to kind of do the economic recovery in the most prudent way possible. You got to do the public finance, and again do this in a way that is consistent with the longer term reforms we need on expenditure quality and debt quality and quality of and tax capacity. And then all of this is then going to be predicated, the effectiveness of the expenditure is going to depend on whether you built the state capacity and whether you kind of optimized our federal structure for service delivery to kind of use this crisis as an opportunity to not just take the actions that are needed to get out of the crisis, but to put ourselves on a much stronger footing for a longer term, just higher quality of life and recovery, like for the country going forward. So thanks so much, and apologies again for going over, but this has been, I hope this has been useful. And thanks again to Dr. Shiv Kumar and ILSS and the co-sponsors for putting this together. Thank you.
I'll just take a few minutes to synthesize, because you've given us so much food for thought and so much to digest upon. Just to tell you some broad messages that I have picked up. First of all, I think we should go back to the beginning and understand that the coronavirus has really inflicted very serious damage to the lives of people. Much of it could be irreversible, and to the economy as well. And we still don't know how this is going to play out. So we are in a very difficult situation given the uncertainty of the future, but at the same time being pretty sure that what has happened so far has been unprecedented in terms of a human crisis and a humanitarian crisis. At the same time, Karthik, if I'm listening to you, you're also flagging some great opportunities to make use of this crisis, to rethink what India needs to do, or at least what the state in India needs to do. And I have got these 5 points over here. First is undoubtedly, this is an opportunity to rev up the public health system and the primary healthcare system across the country. It is not just about investing in addressing the COVID responses, but really taking this as the opportunity to ring fence, to increase the step-up public investments to make a very strong community-based primary healthcare system in India. The second point also, I think, which you're making is very important as we look to the future, not just to the post-COVID response, is that India really needs to institute a very strong social protection system. We cannot have so many people falling through with no economic security, food security, health security, and all those things. So I think the emphasis that you gave on subsidized or free food, on some kind of cash grant, whether it is the inclusive growth dividend or some variant of it, plus universal health coverage, are absolutely critical elements of a social protection program. And I think this should be a wake-up call to state governments at the center to say that if we are really, while we are planning to become a $5 trillion economy, we cannot do so with such a fragile social protection system. The third one is, again, you're entered into a very interesting area of what is the stimulus package really doing? I know that you didn't comment on the stimulus package, but I think the message you're giving is very clear that we really need to put money in the hands of people and consumers to boost aggregate demand, because the multiplier effect of expenditures is extremely important to recognize. And this is not certainly achieved by repurposing the existing budget. So if you really are talking seriously about reviving the economy, giving a demand stimulus, making lives easier for people by putting money in their hands or cash in their hands, then we have to borrow, and we have to do bring in some additional funds into the economy to be able to do this. And repurposing the existing budget is not the answer. The fourth one is, of course, you talk about effective federalism, and I think everybody will agree with you, because this is the real essence of that all these topics, health, education, social protection, livelihoods, are all state subjects, and states are primarily responsible. So we really need to find ways of empowering states. In fact, we don't have time for many questions and answers, but one of the questions I got was, what would be your advice to a state government like Kerala, considering that its revenues are heavily dependent on tourism and foreign exchange, both of which have been hit badly, but that state is plodding along, the only left democratic government in this country, left government plodding along, saying we will prioritize public spending on welfare of people first, and health as well. Health, of course, there's a tradition of doing that. But how do we really get state governments the resources and the capacities to do that? And I think the last point is, you couldn't touch upon it, but everybody will agree with you that we really have to build capacities at the state, district, and local levels for better implementation. And that is becoming ever so evident now, because at the Gram Panchayat level, in most states, we don't have any information. Who are these people? How many people have gone out? How do you track them? How do you reach benefits to them? And unless the community is involved in these kinds of exercises and participating in local decision making, I think a lot of this will still be platitudes at the top, with very little benefits leading to the people. And I want to end this by saying that when I look at what the response of the state has been, the Indian state, there are several moral and ethical issues that we must reflect upon. How can government officials and political leaders be so heartless? And how could they have not thought of the suffering of these millions of migrants, poor women, children, walking and cycling for hours and hours together? Don't forget, in many parts of India, we are touching 40 degrees, 45, 47 degrees centigrade temperature. Why weren't shelters built? Why can't food and water be given, however difficult it is? Can this extraordinary power of the state not be used to ensure safe travel and speedy travel for our migrant workers back to their homes? So it really, to me, the COVID crisis, I'm sure we will overcome it. The health pandemic we will take care of. The economic crisis we will address. The humanitarian crisis we'll also address. But it really focuses on the character of the Indian state as we move ahead to make this a very significant economic superpower in the years to come.
So, thank you.
Thank you. Thank you all for listening to us. Bye. Good night.